6734. When we were welcoming the year 2020, we never thought we would have to say bye to dining in restaurants, going to school, hanging out with friends, being packed like sardines while listening to our favorite live artists or enjoying our favorite sport. But most importantly, we did not think we would have to say bye to more than 5 million people. What caused this? A global pandemic that has now drastically changed all of our lives. In this video, we will look at how scientists and healthcare professionals have guided us to prevent the spread of COVID-19. 6734. Overall health. Since the beginning of hearing the novel coronavirus in the news reporters began stressing that anyone with an underlying health condition could have a higher chance of contracting and not surviving this virus. An article by SN Comprehensive Clinical Medicine says it is believed that COVID-19 and those with underlying health conditions or comorbidities have an increasingly rapid and severe progression, often leading to death. In this article, they did their research from January to April 2020. From March 1st through March 30, there were a total of 180 patients. 89.3% of them patients had an underlying comorbidity, and 94.4% age 65 and older had at least comorbidity, of which the most common were obesity, hypertension, and diabetes. In a study by Preventing Chronic Disease, overlooked by CDC, the results among the Premier Healthcare Database Special COVID-19 release, almost 5 million hospitalized adults were patients with COVID-19, in which 94.9% had at least one underlying medical condition. Relative risk of death in the full model was 30% higher with obesity, 28% higher with anxiety and fear-related disorder, 26% higher with diabetes with complication, 18% higher with neurocognitive disorders including dementia and Alzheimer's disease, 18% higher with chronic obstructive pulmonary disease, and bronchitis. These conditions were also associated with the higher risk of intermittent mandatory ventilation and intensive care unit admission. Although we can't really control or prevent some underlying conditions like kidney disease, cancer, and other underlying medical conditions, we thought it was a critical part to mention for those who may have these increased risks, so we know just how serious catching this virus could be for those individuals. With that, continue to apply preventatives like the ones we will be mentioning in our video, like hand washing, social distancing, masks, location, and vaccines to prevent the contraction of COVID-19.
1997, 10 months into the pandemic, hand washing with soap remains one of our best defense against the virus, said the World Health Organization on October 15th of 2020, though they take special care to remind citizens that hand washing is not the only form of preventing COVID-19. They inform us that it certainly does help, coupling with other techniques that will be discussed in this video. Hand washing seems to be very effective. The WHO recommended that coronavirus can be contracted through direct, indirect, or close contact with infected people, and that regular, disciplined hand washing is a must to reduce risk of transmission. They also mention how hand sanitizers should be used when soap and water are not available.
Masks 0835. The CDC, WHO, and FDA are all in agreement that masks with proper filtration, fit, and use are not only safe but also critical keys to prevent an individual from contracting COVID-19. The CDC strongly recommends that everyone over 2 years of age and not fully vaccinated wear a mask when in a public setting where they could be exposed to infected individuals. They note that masks should be worn indoors when one is around others they do not live with or when caring for an individual who has symptoms or is tested positive for the virus. The CDC strongly suggests that individuals with weakened immune systems, regardless of vaccination status, adhere to all safeguards recommended to the unvaccinated and wear a mask when in areas of substantial or high transmission to maximize protection. The FDA seems to agree with virtually all the views of the CDC, but they place special emphasis on how filtering facepiece respirators and surgical masks are the only types of masks that act as more than a source control, meaning that other masks only protect other individuals from contracting the disease from an infected wearer. If the wearer is not infected, they are not protected from sick individuals unless they wear a respirator or surgical mask. In 2013, Cambridge University Press published a scientific journal presenting evidence that when wearing a mask, the risk of infection is only reduced, not eliminated. This is in agreement with similar studies conducted by the previously mentioned well-known governing bodies. This article went on to highlight the importance of combining the use of quality masks with proper hygienic practices, social distancing, and other methods also supported by government bodies. Though this experiment was performed to test the efficacy of homemade masks against influenza, the results are helpful and relevant to current struggles and questions, reminding us that even a homemade mask in place of a surgical mask is better than nothing. This image, borrowed from a peer-reviewed research article titled Mask or No Mask for COVID-19, a public health and market study, depicts the not-so-subtle difference between reported cases of infected individuals in masked and unmasked countries. This same article views masks as a reasonable method to reduce the spread of the virus, but they, like every other article that has been or will be mentioned in this report, stress the importance of practicing other safety methods on top of mask wearing for best results.
1997. The CDC strongly urges to stay 6 feet away from others, otherwise known as social distancing. We are expected to abide by this standard every time we are outside the home, especially if we have a higher risk of infection. This advice is suggested to be upheld even when one is inside their own home. If an individual in their household is infected with the virus, similar to the rules that should be applied to masks. The figure from a scientific study conducted by the CDC shows the number of confirmed coronavirus cases when social distancing and when not social distancing in a 180-day period. Groups A and B reduced their contact by 25%, C and D reduced by 75%, and E and F by 95%. This seems to support the statements emerging from Dr. Fauci and the CDC and other government resources regarding the effectiveness of social distancing to reduce the spread of the coronavirus.
6734. Location. It has been proven not only in this report but also by scientific literature and government organizations, mass aids in the reduction of the spread of COVID-19. A study performed and recorded by Michael H. Hajar and others concluded that the odds of an urban and suburban shoppers wearing a mask was about 4 times greater than rural storegoers. This would indicate that because of the use of mask aid results in lower contractions and fatalities due to the virus, that there are higher contraction rates and fatalities in rural areas compared to the urban and suburban locations. This article suggests that implementing mask mandates in these areas are the only way to improve the outcome. There is a limited supply of scientific literature relating to this topic to compare the results of experimentation described in this article. The Organization for Economic Cooperation and Development concludes that the impact of COVID-19 crisis differs markedly not only across the countries, but also across regions and municipalities within the countries, both in terms of declared cases and related days. This image demonstrates the number of COVID-19 fatalities per 100,000 participants. It appears that the problem is more of a combination of density plus other factors such as a lack of appropriate measure, such as contact tracing, poor housing conditions, or limited access to healthcare. In a certain location in each country, specifically the big cities, although in the U.S. reported cases in rural areas have been increasing compared to the more densely packed regions. As shown here, counties in metro areas in dark blue saw a confirmed case rate obviously higher than all the rest for about 2 months before it started getting tangled with the other rates from 6 through 20 onward, and reported cases in rural populations began to define themselves between the 9 through 20 to 10 through 20 mark, skyrocketing by 11 through 20. The OECD suggests that effective testing strategies combined with social distancing are ways to limit these effects. The CDC also states that crowding coupled with poverty increases an individual's risk for contracting the disease. Neither of these government resources agree with the view of the author of the scientific article previously mentioned in this report that masks should be mandated to reduce the negative effects of population density.
Vaccines 0835. The CDC states that the COVID-19 vaccination successfully combats hospitalizations and deaths due to the deadly virus. Nonetheless, the reports show that it is less effective among high-risk individuals. Other important findings suggest that fully vaccinated individuals face less severe clinical outcomes than the unvaccinated, and infections in the vaccinated may be more difficult to pass on to others. The CDC claims that COVID vaccines are safe and effective. They do, however, reveal some possible side effects of getting the shot, which are anaphylaxis, the development of thrombosis and thrombocytopenia syndrome, Guillain-Barré syndrome, myocarditis, pericarditis, and death, though it has not been proven that the COVID vaccine was the cause. Nevertheless, the New England Journal of Medicine says the coronavirus vaccine is 95% effective after the first dose and 94.6% after the second. The blue line indicates the number of participants injected with a placebo that were later infected with the coronavirus. The red line indicates those given the real vaccine infected later, and the dark marks indicate those participants who suffered from severe cases from the time of taking the first dose to the end of the surveillance period of the experiment. In a scientific article written by author Grace M. Lee, It is emphasized that because the COVID-19 vaccine is a messenger RNA vaccine, it is often associated with myocarditis. However, she points out that while mRNA vaccines have been known to do this in the past, they can actually prevent cases of myocarditis, acute kidney injury, arrhythmia, and thromboembolic diseases as well. She also concludes that risks vary from person to person according to place and over time. Likewise, other scholarly articles concluded from their own testings that the risks and grade of adverse events induced by the vaccines were minimal compared to those of the severe symptoms induced by COVID-19. Countless other experiments have been done, repeated again and again, to ensure the safety of individuals when taking the vaccine. However, because this vaccine is relatively new compared to other time-tried vaccines, its long-term negative side effects cannot be determined, only guessed at with fingers crossed that they are minimal or non-existent.
We hope this video can bring awareness to the severity of COVID-19. However, thanks to vital research and a perseverance of medical personnel and scientists, we have overcome tremendous obstacles. But look at where we are now. We're back in school, movie theaters are open, and most importantly, COVID cases have decreased and lives have been saved. Although COVID-19 has drastically changed our lives, we can count on science and the practice of medicine to help us move forward. As Dr. Fauci said, science is telling us that we can do phenomenal things if we put our minds and resources into it.